Guys, I just want to say she doesn't dance or exercise, and even if she does, it's at 12 a.m. in the night. Trust me. I am obviously the most amazing and intelligent person you've seen on this channel.
Hi, today is a very special day because I have a very young and enthusiastic interviewer with me. She's none other than my own daughter, Miss Arana Dwarka. This year's World Cancer Awareness Day slogan is United by Unique. That means, as cancer specialists, we understand your needs for special and tailored treatments. So, Arana, were there any questions that you needed to ask me?
Well, this is a podcast, so yes. First question: how has being a cancer surgeon impacted your perspective on life, and what lessons have you learned from your patients?
So, the most important lesson that my patients teach me is patience, perseverance, and strength. When push comes to shove and life makes you face difficult, challenging situations, the fighting spirit is something that we can't let go of.
Can you share a story about a patient who has inspired you or left a lasting impression?
Recently, a very young lady came to me who had ovarian cancer, and she completed all her extensive surgery and followed by chemotherapy, and now she is back to work, back on her toes, and she runs. She is a marathon runner, so she has not stopped cancer from making her lead a unique life.
Inspiring. What do you think is the most important thing for people to know about cancer prevention and early detection?
Early detection saves lives. So rather than being scared, rather than having misconceptions about vaccination, it is important to get full information, act fast, do as recommended, and then even if you are diagnosed with cancer, don't think it is the end of the world, because there's a beautiful life that lies on the other side.
How do you handle difficult conversations with patients and families? And what advice would you give to others in similar situations?
Yes, it gets stressful sometimes. Sometimes we do not, because when the cancer is detected at late stages, and sometimes we do not have anything curable to offer them. But support is something that everybody seeks for. So, when I treat my patients, the most important component of that conversation is hope. Because hope, if you don't have hope, you don't take the first step, and then there is no way that you're going to embark on that journey.
What are some common myths or misconceptions about cancer or cancer treatment?
The most common myth or misconception that I often hear about cancer is that it is the end of the world. And it takes a lot of courage and teamwork and support to fight it. So, for everybody who's watching, make sure that if you are detected at a final stage, then there are a lot of treatment options available. Even if cancer is detected at the last stage, we do have some targeted therapies and some palliative care which will make your quality of life okay. So that is what makes it different.
Now, what inspired you to become a cancer surgeon?
What inspired me was the struggle that I saw of old age when people were diagnosed with cancer. They were made to live in a corner of the house, not being able to take care of them, and it made me question whether there is something that I can offer them, whether there are other treatments, more advanced techniques, and more vast surgeries, extensive surgeries, which will make them lead a good quality of life.
Can you describe a particularly challenging case you worked on?
Yeah. Recently, there was a young lady who came to me. She had previous 4 cesarean for her 4 children, and during the last cesarean, there was some injury to the water pipe or the ureter. For that, she had to take her uterus removed. She received 12 units of blood. She was in the ICU for good 28 to 30 days, and doctors gave her a chance of 5% survival. And she came to me from Iraq, and she had an ovarian cystic mass, and we did not know whether it was cancer or not, and it was a very tough challenged to enter the abdomen because she had a hernia surgery also. All her intestine was jumbled up and inside, and we were very scared we might hurt the intestine. I did not want to open her tummy because I wanted her to be back by New Year's to reach her children. And luckily, after 6.5 hours of extensive dissection, we were able to take out that mass. It turned out to be non-cancerous. She flew within 2 days of the surgery, and she was back at her home in order to celebrate New Year's with all her 4 children.
Nice. Now, how do you stay updated with the latest advancements in cancer treatment?
So after work, sometimes I have to take care of people at home and also deal with their tantrums.
I don't do
I never
tantrums.
said that you do, but whatever time I get, I do tend to read articles, read the latest guidelines, see what is happening, and also go for conferences and CME to meet people and know what they are doing.
What advice would you give to someone diagnosed with cancer?
Hope, hope, and hope. We work together as a team, but it is them who have to take the first step and never get operated or any treatment done without full knowledge. A lot of information is available on Google and other verified sites. Even we post educational videos. So after taking the entire information, take the first step and get treated.
Nice. And lastly, how do you balance your work and personal life, especially in a high stress field like surgery?
Sometimes it does get difficult, but I tend to exercise, go for walks, or dance. Don't look at me like that. At least 3 times a day, 3 times a week, even with a difficult schedule. If you exercise or have any other art form like singing or painting or dancing or a sport, that can really help you take off the stress.
Guys, I just want to say she doesn't dance or exercise, and even if she does, it's at 12 a.m. in the night. Trust me, we all have suffered.
शाबाश बेटा.
Anyway,
बहुत
yes,
बढ़िया मुन्नी.
I am obviously the most amazing and intelligent person you've seen on this channel, and definitely not heard. So I know you all will miss me. I know I will miss you too. I mean, like, who wouldn't miss someone like me? So if you really do miss me, you can definitely go check out my channel on YouTube, Griffinox, GRIIFINXOX. I love roasting edits, and you all should love me too. Please subscribe to my channel, and if she announces you out, just comment on my videos. I will definitely help you out. Bye.
This was not supposed to be a paid promotion, and she is not giving me any fee for her promotions, but thank you, Rayana Mendirata, for being with us today.
Please thank me. Please do.